Next speaker is Dr. Supreetha KUMARESAN, and she will be speaking on Beyond the Night, Exploring Ocular Morbidity in Obstructive Sleep Apnea.
Dr. Shri Harsha is there? Right. You can have it prepared there.
Good morning. I am Dr. Supreetha, here to present on the paper Beyond the Night, Exploring the Ocular Morbidity in Obstructive Sleep Apnea. So I will be discussing under the following headings. Obstructive sleep apnea is a very prevalent disorder, particularly in the adult population in India. And in this condition, there will be repeated episodes of upper airway obstruction, which will cause hypoxia and sleep disturbance. As we know, retina is the most oxygen demanding tissues in the body, and hence it is majorly affected by hypoxia. Some mechanisms were postulated. The important ones were the intermittent hypoxia can cause increased sympathetic response, which will result in higher oxidative stress. Also, we came across that endothelin 1 is a potent vasoconstrictor was released in OSA, which will cause endothelial dysfunction. So, aim of our study is to determine the characteristics of ocular characteristics in OSA and hypoxia-induced visual morbidity. So, we also try to highlight the importance of ophthal screening in this common disorder. So, our study was a prospective study done on a cohort of 156 patients in a period of 1 year. So, all the patients with obstructive sleep apnea who had come to our clinic and referred from pulmonology were screened. So, a complete ophthal evaluation was done, and ancillary investigations like OCTA was done as and when required. So, there was a male preponderance in our results, and also there was a higher incidence in the 5th decade. Out of the 156 patients, 18% had significant ocular complications, the most common being normal tension glaucoma, idiopathic intracranial hypertension, and keratoconus. There were other few included ocular hypertension, CRVO, central retinal artery occlusion, and floppy eyelid syndrome. So, there were many associated comorbidities. More than 50% of them had, the most common being obesity. The others were diabetes, hypertension, and other metabolic disorders, which were overlapping. So, of the patients who had ocular complications, we noticed that 1/3 of them had significant visual loss. Though normal tension glaucoma was the most common in our study, the vision loss was comparatively lesser as compared to keratoconus and ocular CRVO, which had a higher visual loss, and maximum being in CRAO. So, ancillary investigations like OCTA was done in patients who we suspected who had retinal pathology. We noticed that there was retinal vessel density was reduced and blood flow to the choriocapillaries was also reduced. This suggests that there is a microvascular damage in the retina due to OSA, and this can potentially affect the vision. So, there were some detailed literature review we did, and the most common in literature was NAIOS and floppy eyelid syndrome. However, we did not come across that in our study as common. And there was others like keratoconus and central retinal retinopathy, which had varied prevalence. In our study, keratoconus is one of the higher occurrence. And glaucoma was the most commonly seen in our study. So we understand that normal tension glaucoma was more common than ocular hypertension. This can be due to global decrease in blood flow. So it will decrease both the aqueous production and drainage. Hence the IOP is normal. But however, hypoxia will directly affect the retina and the optic disc, leading to glaucomatous damage. And idiopathic intracranial hypertension, we came across an interesting study where the CPAP therapy could potentially reverse the IAH, and this further aids the link between the two conditions. So I conclude by saying that in our study we found that there was significant retinal vascular insufficiency in OSA patients due to both structural and functional changes in both the inner and outer retina, contributing to impairment in vision. So we emphasize that ophthal screening is very important in all the patients with OSA to look for the above mentioned ocular complications. And also obesity is becoming more and more common in today's sedentary lifestyle. Hence we again seeing more incidence of OSA, and hence there should be vigilant screening. Thank you.
Thank you so much. So, besides normal tension glaucoma and ocular hypertension, you've seen other cases also in these.
Yes, sir. We came across IIH and keratoconus were also commonly seen.
Keratoconus, has this been reported earlier also with the obstructive sleep apnea?
Yes, sir. Previous studies also have shown, but there has been varied prevalence in different studies. It is not most commonly seen.
Any other ocular problems besides these?
We also, I mean, in studies, the most common was the NAION, sir.
Right.
We are going to do more investigations to see, but in our cohort, we did not come across.
Right. Thank you so much.